I am. Yes.
Okay, so we're gonna add the chicken last because it's already cooked.
Okay.
So we're gonna add the kale. And let that cook down. Look at that contrasting color.
Yeah.
Now kale can be a little overbearing, but it's gonna break down real good.
Okay.
See, it's starting to.
Yep, I see, yeah.
And this is the longest part of this dish is actually the roasting of the spaghetti squash.
Yeah.
So this doesn't take long. It says an hour, but that's just overall.
Okay.
And so as that is cooking down, we're gonna take our shredded chicken. Now keep in mind, you don't have to add chicken. You don't have to add any type of meat. This can be it was vegan up until the point where we added the chicken. There's no dairy. And it does call for cheese, but you don't have to add that as well if you're a vegan, but it can be a vegetarian
So
dish.
just some nice added on optionals if you want to go that route.
And so once all that is cooked down, we'll bring
Health, Francis Mills, and Commissioner Lita Wills of Health Equity and Social Justice is on the way. We had a new employee start, our project director for Moms First started today, so she's just welcoming her in.
And I should say on the record that Councilman Conwell had a family commitment, and so that is why he is not here this morning, but he gives his apologies and might be able to join us later.
Great. All right, so I think if it's okay with you, we could present all of our divisions together and then do questions at that point. Would
I
that be
think that's
okay?
right.
Okay, great. All right, so I'll talk a little bit about the department, just one slide about our mission, vision, and our strategic plan. Then we'll go into each division, and then the last slide shows where we're at with staffing through the end of September 30th and the proposed 2025 budget. So the Department of Public Health. Our mission is to promote and protect the health and well-being of residents, communities, and partners in the city of Cleveland. And our vision is to be the most responsive, most trusted, most impactful health department in the country, not just county, in the country. Our whole strategic plan is on the internet for anybody watching at home. If you just go to the About section on our website, you can read through that. But our strategic principles that we've been working on with a focus on the last 4 years have been our enhanced communications and outreach. So that's why you've seen a lot more of us, hopefully, in the community and on television. Increased community engagement, same thing. And building our public health workforce training program. So we've been really lucky to get funding from the state and the federal government to really support our staff to be able to do training like the REI groundwater training for all of our staff, annual conferences, local public health conferences, state public health conferences, and some national public health conferences. And we've also been able to, I think we're up to 12 master's degree programs that we've been able to pay up to $10,000 for through some state and federal grants. And then lastly, it's one thing to have these programs that you'll hear about today, but we wanted to really focus on making sure that the programs that we're investing in align with the public health outcomes that you're all seeing in your wards. So with that, I will turn it over to division number 1, division alphabetically, air quality. David.
You had to sneak that alphabetically in there, didn't you? Thank you, Director. Thank you, members of council. It's my pleasure to represent the Division of Air Quality here today. We have, it's been an interesting past 18 months for air quality in the Cleveland area. The one set of photographs here from last June, or June a year ago in 2023, shows you kind of before and after, or before, during, and after pictures from the impacts we faced and many others in the country faced from wildfire smoke, and how we have had a new reality with that now. Previously, we had ordinances on the books and we had measures in place, but we kind of thought of those as relics from the 70s. And now we're working on teams to develop approaches should this happen again, how we can respond and better serve our citizens. This is us in a nutshell. We have, in one of our major roles, we fulfill our obligations as a delegated agent of Ohio EPA. And in that, we work on state permitting, enforcement, and monitoring of ambient air quality. We also have Department of Homeland Security and some grants from Ohio Department of Health. Our outreach program is our main general fund activity. And we're in that area, we have really expanded what we are providing in the community. We reach out to communities, be they ward meetings, block meetings, various special events throughout the year. We provide educational services through a Lego workshop that is a STEM-based development curriculum. And also with that group, again, looking back a bit, they were instrumental in, they along with our monitoring group, were instrumental in public messaging during public health advisories when the wildfire smoke was such a issue for us.
Okay.
That's
Great.
us.
Okay. Thank you, Commissioner Hearn, and I'll turn it over to Commissioner Wallace Chambers for the Division of Environment.
Okay, how everybody doing? My name is Wallace Chambers, fairly new to the health department, only been here about 19 months. I'm gonna talk about 3 of our major programs. Some of you guys may be familiar with: food, lead, and nuisance. But just for your own information, we do other programs such as pool, schools, and body art and tattoo, but I won't focus on those for the sake of time. So as you may know, we do a lot of food shop inspections, which includes restaurants, gas stations, hospitals, and daycares. On average, we inspect about 6,000, we do about 6,000 inspections per year. We have different types of inspections. We have risk classification, we have mobile, we have vending, we have temporaries in which we conduct inspections on. We also do enforcement, far as the placard shows. If a facility doesn't have their license, we'll issue a cease and desist order, and we'll go out and place that placard on the property. Sometimes that leads to court action. I work with the law department, and lately we've been doing what we call food shop complaints. So when somebody doesn't have a license, we trying to step up our enforcement activity and start taking them to court now. And that really helps people get licensed, and it really helps with our compliance as far as getting people to pay their fee on time for the March 1st designation date. So that's been very useful as well. And on those slides are just pictures of things that we find during our inspections when we do our inspections at different facilities. The next one is the local code enforcement. Again, we do different type of activities. Some of you may be aware, a lot of you guys put in complaints as well. We do rent abatement, mold, yard waste. Those are the big things. We do trash. Also, that program does laundromat inspections, barbershops as well, and motel inspections as well. But those are the major things that they focus on. Those are the biggest complaints that we receive from that department. And lastly, many of you are familiar with the lead poison prevention program, in which we do investigations on children who are lead poisoned. So when a child is lead poisoned, we get a report from the Ohio Department of Health saying that their blood lead was 10 micrograms or greater, and at that time that triggers a public health lead investigation. And at that time, we go out to the property that's the child resides, and we do a lead risk assessment. And based on the risk assessment, we issue a lead hazard control order. And also, we had received $1 million grant from the Ohio Department of Health to do some primary prevention activities, in which we're going to do, as you see in that corner there, the upper right-hand corner. We plan to do some billboards and education and outreach in all the wards to inform people about lead poisoning and get them to get tested.
All right, and with that, I'll turn it over to Commissioner Francis Mills and the Division of Health.
Good morning to the chair and other members of council. In order to prevent disease, promote healthy lifestyles, and protect the health of persons who live and work and partner in the city of Cleveland, the Health Division, through the Office of Epidemiology and Population Health, monitors the presence, spread, and impact of disease investigates outbreaks, collects and reports on disease data to identify vulnerable populations to inform the department's planning and educate the community. So 2 examples of some of the data briefs that we've done over the course of the last several years. The second data brief is a data brief that talks about cardiovascular health, and then the brief on the left, the infographic, demonstrates syphilis in the infant community. So we may be asked to gather information on specific health issues, and we produce infographics and data reports and briefs relative to what is happening in the community. Next slide. Our 2 health centers house our nursing and reproductive health services, where we provide adult and childhood immunizations, STI, HIV testing, treatment, and linkage to care. In addition to our clinical services, our nurses inspect daycare centers licensed in the city of Cleveland. And last year, there were a little over 200 daycare centers who are licensed in the city of Cleveland. In the slide, you will see to the far right, it is just one of our typical exam rooms out of the McCafferty Center. We had the opportunity to move into some new space that had been vacated within McCafferty. And so while we're still there, we will allow our patients to experience a better space until we're moving on to our next new home in the community. And then our mobile unit was much more active this year than last year. We were able to get out in the community once a week and rotate between 3 of our recreation centers in the community, and anticipate we'll do much more of that as we get the second mobile unit rolling in 2025. Next slide. Our emergency preparedness is our boots on the ground, ensuring that we are responsible and effective in protecting citizens in the wake of public health crises and acts of terror. And so what our emergency preparedness group does is that they take the health department and other community partners through specific exercises. What would we do in the event that an agent was released in the air? And so to keep the health department staff and our community partners practiced in responding to large-scale events. And in addition, they also support a great deal of what we have done in the past with COVID. So they would step in and work with our teams in order to make sure that we're able to respond if medicines would have to be dispensed to the community. And then the last piece is a huge piece of collaboration with emergency management, the Office of Emergency Management, and other county and city partners. When we have large events in the city of Cleveland, most recently the Rock and Roll Hall of Fame induction, oftentimes we're prepared in the background in the event that some act of violence or other issue would occur in the community. Our team locally, our team from a county perspective, we're all present, whether we're gathering at the Emergency Operations Center or if we're on call, prepared to respond to events. And then our last area is vital statistics, in which our primary responsibility there is to issue birth and death certificates. It is a very high traffic, high volume service that we provide here, right here in City Hall on the first floor, and we anticipate that we would continue to issue upwards to over 40,000 birth certificates annual, with requests coming in from the state, and death certificates as are requested from funeral homes and family members. And finally, our last growing area is in 2023, we hired a food policy strategist who is working with other departments in the city, as well as auditing the policy needs relative to food systems, food justice. And so we anticipate in 2025 we'll be operating in response to a food policy audit, which has been conducted over the last several months. We're hoping to have a first draft of that policy audit at the end of this month, early part of November. That's all I have.
All right, thank you, Commissioner. And last but not least, Commissioner Lita Wills, Division of Health Equity and Social Justice.
Thank you. Good morning to the chair and to members of council. As you are aware, I'm Lita Wills, Commissioner of Health Equity and Social Justice. The mission of our division is to improve the health outcomes and the overall quality of life by removing barriers to resources needed to create thriving neighborhoods and a thriving city. As you'll recall, in November of 2020, Cleveland City Council introduced legislation to create the Division of Health Equity and Social Justice within the Cleveland Department of Public Health. We focus on finding solutions to health inequities and disparities, looking at root causes of health inequities that are systematic, affecting our social, economic, and environmental health. Within the division, in terms of our work at the Health Department and CDPH, we have several programs underneath our umbrella that address very specific health inequities. Those programs are our HIV/STI office and projects, our Office of Minority Health, our Office of Mental Health and Addiction Recovery, and our Moms First program, which is a federally funded Healthy Start project as well. Within the City of Cleveland, our equity initiatives that stretch across departments mean to operationalize equity across City of Cleveland departments using social determinants of health as a framework for that work. We have stood up two main projects in that vein, the Interdepartmental Equity Team, which we just launched our strategic plan this past summer. It is now available on the City of Cleveland website, as well as our health and equity impact assessment tool that team uses to find disparities and inequities within our existing policies, practices, and procedures here at the city. Also, we have launched an equity advisory group that consists of several members of different departments across the city that has put together a series of recommendations around diversity, equity, and inclusion for the city. And our last area that we work in is with the Racism as a Public Health Crisis Coalition. This office serves as the conduit between the city and that body, and it is a public-private partnership focused on looking at health disparities and health outcomes that are a direct result of racism as a public health crisis. Next slide. Some of the work that we have been doing this year within our programs at CDPH, within Moms First, our HIV/STI projects, our OMAR, or Office of Mental Health and Addiction Recovery, and our Office of Minority Health. Obviously, I am very far away from this slide and I can't see it. We have 600, more than 600 new moms and dads have been served through Moms First in this last period. With the help of our partners at Metro, as well as as risk management here at the City of Cleveland, we have trained staff members across the City of Cleveland to be able to administer Narcan, and provided Narcan kits installed at the city rec centers, as well as I believe if they're not in already, they should be going in here shortly here at City Hall as well as Public Hall. We've been providing layperson naloxone training in the community as well. Councilman Jones, could you just slide just a hair? Thank you. Our health information thank you, Commissioner.
Yeah, that's farther. I was looking at that.
Sort of. All right. Thanks, everybody. Gosh. Provided health information to over 400 participants through our Office of Minority Health, and our housing assistance and testing, which is through our HOPWA funds that we get from community development, and our CDBG funds that we get from them. So between housing services, wraparound services, and HIV testing have served over 800 participants. Next slide. As I mentioned, our interdepartmental equity team released the 3-year strategic plan. Again, the interdepartmental equity team also consists of members from various different departments across the city. The plan itself, the full plan, is available on the city's website, as is our accompanying process for health and equity impact assessments, which we are conducting now on various policies, practices, and programs throughout the city. We expect to, by the end of this year, have completed 4 to 6 of those assessments, and then within a full year of conducting those each year to have a minimum of 12 of those assessments completed. Next slide. Also, as I mentioned, within the division, we are the conduit between the city and the Racism as a Public Health Crisis Coalition. That group, which Commissioner Mills and myself participate on the executive committee for, has completed this past winter a number of community engagement dialogues. They have also wrapped up and released their major report that it's wrapped up. It is the draft is being finalized, and it should be released here shortly. And there is some information about that group as well in terms of the social determinant of health areas that they are choosing to monitor throughout the next several years of their work. Next slide. I think this might be the end.
Yep, that was it.
It's just our.
Yeah, I can go through that.
Okay, good.
Perfect. You did
Thank
it?
you.
Yeah, thank you. Awesome. All right, well, thank you so much to our commissioners of our 4 divisions. Lastly, I'll just run through where we're at with staffing through September 30th. So that top row was our budget from 2024. In parentheses, you'll see the 3 additional positions we got in the Division of Health from the notorious vacancy pool last year. So that was added to our budget in 2024. As you can see, we're pretty proud of where we're at. We've been really working hard to staff up. This is just our general fund positions. So overall, we're at nearly 150 employees, up from something in the high 90s 2.5 years ago in terms of total employees. So we're at about, I think it's about 70 general fund positions, 70 plus grant funded positions. Our vacancies are listed in that 3rd row through September 30th, but we've got already people on the way for many of those vacant positions, or they're currently posted and we're waiting for certification from civil service. And then, we've got our grant funded staff right there. And then our approved positions or our asked for positions going into 2025 are just 1 additional environment, 1 additional in air quality, and 1 additional in administration. And so with that, I will turn it to all of you for any questions that you may have.
Thank you very much. I know that we will have a number of questions from the committee. I'll start off with a couple, which is that the head count we got was from 9/15, so just a couple,
Okay.
like 2 weeks before, and it had 9 vacancies. So I wanted to just check that that was commensurate with your understanding that we had onboarded people within those 2 weeks at the end of September.
Yeah, we've been onboarding pretty much nonstop all summer and into the fall. And so, let's see, in the last 2 weeks, we've added our LPN, Division of Health, our specialist, support specialist, our Moms First director today. So yeah, it's you know, I have a most recent org chart with all the names here, and it's constantly fluctuating, as you can imagine.
Got it. And then those 4 open positions within the environment, again, we had that as 6 as of 9/15, so it sounds pretty commensurate. But what are those positions within the environment?
So the current positions that are open in environment are one of our SAN 1s, so on the local code enforcement team, just got promoted up to the food safety team. So there's an opening there. And then we've got 3 positions that are health inspectors.
Okay. And I wanted to ask a little bit about the launch of 311 and the environmental complaints, things like accumulated debris, garbage, infestations. I continue to really struggle to get feedback on complaints. I can ask Manager Peterson for responses, but we've changed inspectors a number of times. It's seeming to take a lot of re-inspections. And so I wanted to ask, as we look ahead to 2025, if we're committing to getting the environmental health complaint management system on board with 311 and then have a new management tool.
Yeah, through the chair, we would love that. That we're not there yet, so we're just waiting for the 311 software to be ready for us.
So you can't commit to having it on board with 311 in 2025?
It's not a decision that is in our department. So we're waiting for ITS to say, that they're ready to onboard us on there. So.
Okay. Is there a way to get, there was a time when Manager Peterson would send us reports, and I know he sent them to our executive assistants and not to the council members, so sometimes I've missed them, but usually my EA tries to send them to me when she gets them, and we haven't gotten them in many months. What I'm saying is these seem to just disappear into a black hole, and they're really critical ones, and it's taking 3-4 follow-ups from my office to get responses on them. So how can we best work with you guys in the absence of utilizing 311 to make sure that these bread and butter complaints are actually dealt with?
Yeah, through the chair, they're absolutely being dealt with. I think the challenge is that when there's accumulation of garbage, someone calls the health department, we'll go out, give them a ticket or a citation, and the garbage is still there, and so it might be seen as not being dealt with, but we're dealing with it with the tools that we have. So I wasn't aware that the monthly reports weren't going to you still. I still see them, and so we'll fix that on our end so that you're getting them.
Yeah, that'd be great. And I'm happy to send you some examples, but there have been many times that the inspector doesn't go until 6 weeks later. We check in, and then it fell through the cracks. And Ward 12, we changed inspectors a number of times, and I really respect what Manager Peterson is trying to do, but it's been tough this summer to get responses on illegal dumping. Even just getting the inspector out there has seemed very challenging.
Through the chair, just a reminder that illegal dumping is not the health department. That's in public safety.
Yeah, I want to be very clear. I know that,
Okay.
and we have the illegal dumping team that manages the illegal dumping. But often when it's on private property, I first need the health department to go out there and issue a ticket. So that, for instance, if there is this took over a year to get done. But I had a couch in a backyard that was in an abandoned property, and I could not get Public Works to deal with it until the health department ticketed it, and it took more than 9 months to get the health department to get out and ticket it, and then Public Works was able to get it within 2 weeks. So these are the types of things that I just don't want to have to follow up 3, 4, 5 times on one of these.
Through the chair, we don't want you to have to do that either. Thank
Great,
you.
thank
But please include me in those follow-ups just as
Yeah, no
for
problem.
all the council members as they do.
I'm more than happy to. Next, we're looking at I was looking at the capital expenses. That was one of the materials that was sent to us. A couple of capital expenses, Director. A number of them small, like HVAC at McCafferty. But there was a $1 million commitment to the Birthing Beautiful Communities, and it looks like it's been encumbered but not expended. I just wasn't aware of this, so I was wondering if you could give us a little bit of background on the plans to spend that.
Yeah, through the chair, that was a council project through ARPA funding. And so their groundbreaking, I think, has just happened. It was going to be the day that the Supreme Court Justice was here, and so they maybe didn't have the ceremony and are breaking ground, but once they start doing some work on the groundbreaking, they'll send in reimbursements for us. But they're fully anticipating to finish that project before the deadline for ARPA.
Yeah, so that was my commitment. So this is hard ARPA, so it has to be spent by the end of this year or the end of the next year?
Through the chair, I think it's by 2026. It's been a long time since I've thought about ARPA.
Yeah, I know.
Right, but yes.
All right, thank you. So that's hard ARPA, and we're looking for that to be expended by the traditional deadline. And then the $3.5 million out of $5 million for the lead program. I know you are doing a lot of lead programming across a lot of different elements of the health department. I was wondering if you could share what is covered under that $5 million allocation and what the 3.5 spend down has gone to.
Through the chair, can you show me what you're looking at? I'm sorry.
Yeah, I apologize. This this was under our what we got today as the public health admin capital, and I can show it to you, but I'd like to show it to the public as well. But,
Okay.
This was the, sorry.
Thank you.
Yeah.
It's the PDF Public Health Admin Capital. It's in our folder if you want to put it up.
Through the chair, I'll have to get back to you just to understand what that is.
All right, thank you. Ibukun, if you could mark that as a follow-up that, again, there's a lot of different lead programming that flows through health through
Yeah.
a few different pools, but I didn't know what was under capital programs, so we'll get a follow-up on that.
Good flag. I appreciate it.
Yeah, absolutely. With that, that concludes my questions. Is there anyone else on the committee? I see Councilman Harsh. Anyone else? Councilman Starr?
The clock is running?
Yeah.
Okay. I won't need all the clock. Just a couple questions there are going to center around lead, but before we do, through the chair, I saw the rat trap. That was interesting. I have to say, I can count on one hand the number of rats I've seen in Cleveland. They're mostly down by the river because rats need a whole bunch of water, and people see mice all the time and call them rats. And I understand that I've seen a lot of mice in Cleveland because we live in North America and mice run around. I haven't seen a lot of rats though, but I am curious about this picture through the chair. Could somebody tell me about this device they have? And how many of these do we have? And what is the process of deploying and collecting them? Is it like a 1 day, a 1 week? Is it easy to put these out and catch rats and take care of them? Or tell me about the rat.
So that might have been placed by a private company. What we do baiting in holes where there's burials for rats. We put bait down. And that's what we do. We don't have any traps or anything of that nature.
Okay.
But through the chair, this is a bait station,
Yeah,
so
so-
it's a rat would go in here, think it's food, and take the poison back to its hole.
It's not a trap. That's
No,
bait,
it's a
right?
bait station. Yeah.
I see.
And that's probably put down by a private pesticide company.
I see. Through the chair, then, is it easy for us to go out and bait the rat holes, or are we prevented by property rights from going onto land where we might need to do that work? If somebody calls and says there's rats in the abandoned house next door, and I call you, and your department goes out there, and you say, oh, yeah, it's an abandoned house, but it's still owned by John Doe, who might be dead, it doesn't matter, it's still owned by John Doe. Are we able to like go bait those properties through the chair?
Yeah, we did some baiting of vacant properties, yes.
Is it always allowed, or we always
Through
can?
the chair, to answer your question, I mean, it is very hard. You've discussed some of the barriers for our teams, I would think, yeah.
Sometimes we can and sometimes we can't.
I mean, if we get in touch with the landlord or the property owner, we can probably go out there and do baiting. But most of the time, we do it on private property.
Okay. Okay. I'm sure all my colleagues hear about rats all the time, and I think it's a fear that lives in people's imagination. Their rats exist, they certainly do, but I get more calls about rats than rats I've ever seen in the city. Every now and then they pop up. To lead, through the chair to the director. When it comes to enforcement of public hazard, lead hazard controls, lead hazard control orders, what are our enforcement tools available to your staff? How do we enforce lead hazard control orders?
You want to start with that?
Yeah, so
Commissioner?
I'm assuming you're talking about once we issue the orders, what we do if they're non-compliant.
Yes.
Usually what we do if the property's not compliant, we placard the property and tell the person not to rent to anybody. If it's a vacant property, we would tell them not to rent to the family. If it's owner occupied, it's hard to do much as far as that's concerned. What we try to do is teach them how to protect the family from lead while they're living there, because most people who are owner occupied, they're not going to leave their house.
Sure.
So we give them the tools as far as cleaning and education on what they can do, and we try to get them through assistance to get them some type of financial assistance to get the house fixed.
Through the chair, is a lead hazard control order ever issued absent a known poisoning? Absent an elevated blood lead level from a child? No?
So what happens is, in order for us to go out there, the child has to be elevated.
Okay.
Unfortunately, we're reactive. We go after.
I understand.
Yeah.
I totally understand this chicken and egg problem that we're all trying to crack.
Yep.
Through the chair, is there any way does the health department have any way, to the director, to investigate rental units that don't have a lead clearance exam on file.
Through the chair, without a child being poisoned
Correct.
first, I'm sure, well, I don't know. I mean, right now that's through Building and Housing and through the prosecutor or through, the Department of Law that they are partnering on those prosecutions.
Well, through the chair, I'm not talking about prosecutions. I'm saying there is the universe of properties that have a rental registry.
Sure.
And there's the universe of properties that have a lead clearance exam and they don't match up. There are
Right.
some properties that have rental registry but no lead clearance exam. Do we have a process to go to those units that have a rental registry but no clearance exam, knock on their door and say, hi, you need to get your lead clearance exam? Do we do any sort of like proactive outreach to those units that they've got the rental registry but no clearance exam?
Through the chair, the Department of Building and Housing is the department that does that through their inspectors, and I think they're up to 275 property owners right now that
Yeah.
they're landlords that they're prosecuting.
So it's not a project you would undertake?
No, so through the chair, the team at the health department is the team responsible for following up on all those elevated lead cases, and then that will often take us to a property. But
Yeah.
yeah, we're doing it from the
It's the
back
reactive
end, right?
instead
Right.
of proactive.
Unfortunately, yeah.
Okay. I'm just trying to figure out how we get into proactive work, and it sounds like it's not going to be the health department's task to do the proactive work that I'm trying to get to. That's going to be either community development, building and housing, some other mixture of folks. And through to the chair, you almost got to one of my questions too when you were asking about the missing positions. But my question was the 5 missing positions in public health, not the. Oh shoot, where'd it go? Or was it at the bottom of the presentation?
Yeah,
Yeah.
I
Okay.
got it. You're
The 5 in just the regular health. You said the missing 3 of the missing were health inspectors in the environment side of the 4.
Through the vacancies.
Yeah, the vacancies. Yeah. So 3 of those are health inspectors. What are the 5 people in the first column there that are just straight
The
up
Division of Health?
Yeah.
So the 5
Nurses.
vacancies, yeah,
Oh.
you can take it.
2
Yeah, here,
nurses.
take the microphone there, Commissioner.
A community health aide, a clerk, and a lab person.
Okay. Thank you, Chair.
Wonderful. Thank you, Councilman Harsh. I have Councilman Starr and then Councilman Jones and Councilwoman Gray.
Thank you, Chairwoman and Health Department Administrative staff for being here. My question will definitely be about lead. So my only questions, or a couple questions I have is, what type of enforcement or what type of collaboration do you have with assisting property owners with doing lead testing for residents? Is that something that your office can do to actual help support different opportunities to be able to get people tested through the chair?
Through the chair, are you referring to testing the unit for lead-safe clearance?
Or assisting with getting the children or
the
the
children?
residents in the house tested. Right now, I'm working on a different event of collaboration
Yeah.
with CMHA to host some different testing opportunities, similar to how a lot of different entities did the doses for dollars during
Yep.
the COVID time.
I remember
We're
that.
trying to get some residents and their children tested for lead. Obviously, from the report we've seen, just to see where we are at to start a series. We're trying to kick off an event this right before the year ends, so we can try to attempt to start a process. So I was trying to work with healthcare providers, but I don't know which ones who will actually do the testing
Yeah.
from the fingerprint and the blood drawing testing. I don't want to know through the chair, is there some healthcare provider or your department, is that something we're able to do at an event through the
Yep.
chair?
Thank you, Councilman, through the chair. So that is a great idea that you're doing that. I'm working with CMHA right now. We've reached out to Cleveland Clinic and their office, and they're very excited to partner with CMHA on this. Right now, we're just working through the logistics of that. I will also shout out Metro Health has been doing mobile testing for the last couple of years. They were at the event, the Lead Safe Walk, this Saturday. And so there are a few different options in the community, which is why we haven't found the need to build our own, since there are some good programs out there that are ready to heed the call.
Yep, and thank you for working with them. I know CMHA, Mr. Patterson contacted me on Friday, and he said he's trying to get an actual date
Yep.
to put down, but the whole purpose is to make sure we're not just doing the fingerprint and then expecting the resident to follow up. If we could possibly do the fingerprint and the blood drawing there, it can be a great opportunity for us to figure out what the lead levels are, what we need to do going forward. Then we plan on rolling this out throughout all of their properties, and then also following up with other property owners as well. So we're just trying to, see what does the first one look like, and then roll it out to different series of events to be able to do it. Like I've said, if CMHA could do it, the other one should be able to do it as well. So just trying to get on that. So I thank you, Director, for helping out, and let me know anything you need from me.
Okay, thank you.
Thank you, Councilman Starr. Councilman Joe Jones.
Thank you, Madam Chairwoman.
Thank you, Madam Chairwoman. I just want to start out by thanking the director. And here's why I'm thanking the director. Every time I pick up the phone and I need to reach him, he's always available. I think maybe there's a couple of times he didn't pick the phone up, but he called me right back. And I want to just point that out because the simple fact that as council people, we lead such a very, very busy life. If you really care about people, you're concerned about people, you're going to be busy all the time. And people always know that because they're going to always call you when they got a problem and they got an issue. And so I get a lot of phone calls. If I didn't cut my phone off, it'd be buzzing here at this and it'd be ringing, but I was told that how to do it so it won't ring and mess the table up all the time. And so I just really appreciate you, Director, being available. That's what public service is all about. How do we serve our people? And part of what you do is you make sure you answer those phones, and I'm appreciative of it. And I didn't have, the directors before you didn't have that kind of, I would call them and then have to wait until they had the time to get around to call me back. So I'm very appreciative of that. I want to go through a couple of things real quick just so that I can understand how things are and how they work. With the division of the Public Health Administration, we have how many employees in there now? Because I know that last year we had 16 people in the Division of Public Health Administration. What do we have currently now? And then first, congratulations on filling these vacancies that have been vacant for so long in the health department.
Thank you so much, Councilman. I really appreciate that through the chair. I believe we are at 18 right now, including one person who's on a grant fund.
Okay.
Or, I'm sorry, they're not on a grant fund, they're borrowed from ITS, which is, that's why we've requested to go up one additional general fund position so she can officially be on our team.
I see. And then the people who work in the administrative side more or less helps to manage the entire division of health. Is that correct?
Through the chair, yes. That includes our fiscal team that processes all the fiscal stuff to help, made this budget. Our quality and process improvement individual who is helping us through reaccreditation. Our policy affairs, legislative affairs, Meredith Baumgartner-Hand in the room, our HR team, our IT team, our communications team, and our community health team.
I see. And then I want to jump to Commissioner Francis Mills. And what I want to talk about is output metrics. Do you have a breakdown of what you've been able to accomplish this year?
Well, I don't have specific metrics, but I can give you some. In terms of our reproductive health program, so far this year, we've served 2,453 reproductive health clients for 2024 and have done 408 childhood immunizations. And typically, I don't know if you were in the room when I mentioned it, typically our vital statistics, they will issue upwards to 40,000 birth certificates on an annual basis and a little over 60,000 death certificates on an annual basis. With our COVID, we don't have much of any COVID numbers given the shift of COVID from pandemic stage to endemic stage, and just the level of involvement that the CDC and Ohio Department of Health, we're no longer issuing COVID vaccine only to those children who do not have health insurance at all. And so those numbers are negligible for 2024 as we ended that program. Health departments are now required to purchase COVID vaccine at a very, very high price. And so we have opted out and will be issuing for the flu season flu vaccine for our adult population.
So right now, you at one point was giving out the COVID vaccinations, and I know that last year you administered about 1,119 COVID vaccinations, and so this year you can't do it because it's too cost prohibitive?
Upwards to $115 a dose to purchase, and so that is well out of our budgetary, we can't do it. We cannot do it.
With the city of Cleveland being one of the health capitals on the planet, right? Do you have any partners here that could help you with that?
Oh, absolutely.
With the COVID, having the vaccination, reaching the people?
Absolutely.
And then can you make sure, because I heard this, and you could correct me if I'm wrong, that in the state of Ohio, we're still having up to close to 1,000 people dying of COVID. Is that true?
No. No.
So that's not the case now?
No.
Do we know how many people are dying of COVID
I can
in
get
Ohio?
you that specific number, but certainly COVID is so low level, we don't even track it on a monthly basis anymore. And what we track are deaths and hospitalizations. And in our last reporting, there were maybe 30 people who had been hospitalized with COVID, and no deaths that I'm aware of.
Now, I saw a chart on your display here, and it showed that's it. Cardiovascular deaths?
No, not deaths, incidents of cardiovascular.
So how bad is it?
Hypertension is the second leading cause of death in the country. And so individuals who have either hypertension, heart disease, stroke, that's something that we must always be working on in terms of getting people into care where they can get their blood pressure controlled.
And how are we communicating, Commissioner Mills, I'm sorry, on getting the word out for, these various different things that you do, and I know that you received some new buses. I hope you got them by now.
Sure.
I know we talked about that a while back.
Right here, back.
Right. So how many new buses do we have?
We have two. One has been fully operational in 2024 with some wrinkles in terms of repairs that we've had to do, put it out, take it off the road to get the repair. But we are out weekly in the community. We rotate between recreation centers to do blood pressure screenings and to put something in people's hands to say, hey, your blood pressure was this today. You need to talk with your primary care physician. You need to, and we haven't had any instances where we've had to pull out EMS to get a person, but we're out there. And then in terms of community education, the data that we collect, it's good practice for us to get out in the community and talk with people about, were you aware that heart disease is a problem in our community, and this is where we see problems.
And then, what I'd love to get with you so we can do something in Ward 1. Maybe get with the various different health departments and have a health affair event in our community, because there's a lot of people who have heart issues in the community, high blood pressure, and all the other sorts of things, and I would love to do that. And then quickly, rapidly wrapping this division up, Madam Chairwoman, how many, I know that we had budgeted last year for 29 for this department, or what's our total right now, currently?
General Fund 32.
Okay. And then I move on, Madam Chairwoman. Thank you, Commissioner Francis Mills, to Commissioner Wallace Chambers.
Yes, sir.
And I think that the chairwoman talked a little bit about this. This is a major issue for me, would be dealing with our health inspectors. So I presume you're over our health inspectors?
Yes, I am.
Okay. So how many health inspectors do we have currently working for the city of Cleveland?
So are you talking nuisance, or are you talking the ones that do restaurant inspections and pools? Because there's two different.
Right. So for me, the number 1, number 2, number 3, number 4, number 5, all the way to 10, priority is nuisance. That is a major issue for me in my neighborhood, my community, and we have been plagued for the last several years since I've been a councilman. So how many nuisance inspectors do we have?
We have 5 nuisance inspectors at this time, but we have one that just left and went to the food program. So we have six positions slotted. We're in the process of interviewing for the vacant position.
Let me, Madam Chairwoman, if I may.
You may do anything you'd like for 4 minutes and 39 seconds.
Good. I may need to be put back on. See, here's the problem. We, as elected officials, it's our responsibilities to deal with the massive major issues we have to deal with. 5 is not enough. For the entire size of the city of Cleveland, we have 5 inspectors. Why is that, Madam Chairwoman, to the director?
So through the chair, we have 15 to 20 inspectors total, and then when you
No, for just specific nuisance, because
Yeah.
see, I don't want to. See, here's what I don't want to do, Madam Chairwoman, to the director. I don't want to cloud or confuse this up, right? The major issue right now in our communities, unfortunately, is all of this stuff that's happening, quality of life. When people go out and vote, they're voting on things that impact them. And the biggest issue that's impacting the citizens of the city of Cleveland is these nuisance issues. When the garbage, unfortunately, cans are overloaded on these commercial apartment complexes. When you go down a regular, normal street, which is a main street, and you see restaurants with paper and debris and trash and garbage and growing up vegetation. So those are major issues, and I don't need to tell you because I'm quite sure you get inundated with these calls. This is an area where we should have 15 to 20 inspectors in the city of Cleveland. How do we, Madam Chairwoman, to the director, get to that place where we have some people dealing with these life quality issues of our residents who vote?
Sure. Yeah, through the chair, certainly hopefully we'll be back at 6 shortly. We were at 6 for the first time ever this fall, and then promoted one of our folks up to the food safety program. Once we get to 6, if it seems like we need more, that's certainly something you can discuss in February at the budget hearings. But I'll also add, we're trying to do a lot better of the collaboration with building and housing, and the Through One program helps a lot because everything that you're discussing are building and housing code violations as well, and it doesn't help the court or the city to send the same, inspectors from different departments out to the same problem, because it just at times confuses the prosecution process.
Here's where we're having our problem.
Yep.
We're not getting help on either side.
Okay.
So if we were getting some help, that'd be a whole different ballgame.
Okay.
So the issue is why I'm just trying to understand if you can help me, right? Are you saying to me that 5 or 6 inspections are sufficient for dealing with nuisance problems in the city of Cleveland?
Through the chair, I'm not saying that, no.
Okay. So what is your position on the issue of nuisance abatement? How many inspectors do we need to have?
Through the chair, absolutely, we could use more across the board. I guess my point, and I think we should just think about building and housing as doing nuisance inspections as well. And so just thinking about how to look at that number as one figure is the key. And the Through One system will help a lot with that, as Councilwoman Chair Moore mentioned earlier, because then we can see the number of complaints coming in, and you can use that data.
We know how many complaints coming in. We have stats on that, right?
Through the chair, we do.
Okay, so what is our current stats? And I guess I got to ask Mr. Mills. You've been here for quite a bit of time now. How big is the demand for nuisance inspectors in the city of Cleveland? I can only talk
Commissioner
my ward.
Chambers, are you
Yeah,
talking-
Mr.
okay,
Chambers, I'm sorry.
Commissioner Chambers.
I'm sorry,
Doctor-
Ms. Mills.
Dr. Chambers.
Dr.
I was
Chambers.
wondering, I was like-
Dr. Chambers, Madam Chairwoman, Dr. Chambers, please forgive me. Go ahead. How many inspectors, how many, how big is the issue in your department?
So through the chair, currently, last year, I had some, from our strategic planning report, we had 3,862 nuisance complaints received. Excuse me. And
3,000 complaints received.
3,862 complaints received in 2023. At one time, when I first started, we had 4 inspectors. We currently went to 6. We're seeing progress with getting that number, getting our inspectors out there at a quicker rate because we did struggle with the lower number. And then I think council, from my understanding, approved 2 more to bring us to 6. Now, as far as what the magic number is, I don't know if that's 8, 10, 12, but I'm open to that discussion.
And then,
Councilman, I'm just going to interrupt you because you're at 15 minutes, but can I put you back on?
yeah, can I just follow up just this, on this
Absolutely.
here? So, thank you, Madam Chairwoman, to Dr. Chambers. The issue is, these are all complaints that come into your department from the citizens, is that correct?
Yes.
And we're doing nothing but responding to the complaints. So we don't have any offense, is that correct, Madam Chairwoman, to do, Dr. Mills?
Could you repeat that again? I didn't.
We don't have no offense. We're not going out there systematically and giving out tickets.
Actually, Councilman, that's through me, and we're not gonna open more questions. I can put you back on, but if you want to make a closing point, that's fine. But
No,
more
if
back
you
and
could put me
forth.
back on, I'll come back on.
Absolutely, and I really appreciate that question because I think it gets to some of the stuff I was talking about. Do you happen to know of those, what was it,
862.
3,862? How many were closed with no violation?
I don't have that number, sorry.
Would you be able to get that for us? Because I think I'm looking at, I'm looking back through our prior conversations in light of the earlier exchange, and what's happening is that for us, we're turning something in, it's getting closed, no violation. We don't get a notification of that. 3 months later, the resident says, hey, whatever happened? We have to go to Peterson. We wait a week for Peterson. He says it was closed with no violation. We then reattach with photos and say, here's the resident's number, you can go up there, drive, and it's starting this loop like over and over again. And so I'm curious about, if we need to sample size whether those no violations are actually reflective of how often there are no violations. Because I have a number, I'll forward them to you, that were closed no violation where there were violations. Thank you, Councilman Joe Jones. I think that was a great set of points, and I have you back on the list. I now have Councilwoman Gray.
Thank you, Chair. I just want to say, thank the panel for being here. But I want to follow up behind Councilman Joe Jones questioning because we do have a lot of different issues, but the same issues in our community, pertaining to a lot of problems. The first thing I want to talk about is, the rat problem. Who can I address the rat problem? Director?
Yes.
Okay. All right. Now, I just want to echo Councilman Harsh on the rat problem. I know that you have, I'm going to tell you something, Director, you have done a great job with me and the residents, in Ward 4. You have been very attentive to the problems of that, just to say the least. When it comes to Public Works, when they come out and cut the lots, after the lots are cut, that's when you get amount of rats run around everywhere, and those rats tend to enter into private property. That's the most calling, that I get. So could you, could you explain, the situation, how that's done?
Through the chair, I think Councilman Harsh's point earlier on was right on. In that case, you're probably talking about field mice that are coming into the homes, and unfortunately, we don't have a program to help with field mice. That really does require an exterminator who can go in and set up traps in someone's home. And that's not a program that we're able to do. For rats, if there's a property that is contributing to a rat population, we are able to bait and cite the property owner. But in some cases, it does require an exterminator as well.
But don't you, Chair, to the director, don't you come out and put, rat pellets in the empty lots, to prevent mice, that run into private property?
Through the chair, yes, to prevent rats, to kill the rats. Yes, we do bait for rats, and we do have that service.
Okay, so how is that service done? Chair, to the director.
Through the chair, clevelandhealth.org, and at the bottom it says submit a complaint, or you can call 311 and they'll use the dashboard on your behalf. And then as Councilwoman Moore pointed out earlier, certainly we're all looking forward to being on the same 311 system that everybody else is, so that you can see that follow-up, and ensure that the completion of the work was done.
Okay, thank you for that. But my question is, maybe I need to rephrase it. When you send someone out to put the pallets in the partial, how is that done? Or if it's your department, does this go to Dr. Chambers? Chair, to Dr. Chambers?
Through the chair, we usually put the poison through the burrows where the rats burrow, the holes that they burrow.
Okay.
And we also work with the water department, and we place bait in sewers as well.
Okay, so how, do you, Chair, to Dr. Chambers, when a resident said that rats are coming into their property, do you bait around their property as well?
Through the chair, yes.
Okay, all right. Okay, that's the point I was trying to get to, because a lot of the residents, need that type of assistance because it's costly, and they actually blame the city, by them living next to an empty lot, then they blame the city for the cause. So I just needed that answer. Thank you. Thank you for that. And also, I have a couple other questions. I'm not done. Yeah, you got time. Okay, thank you. Okay. Also, want to ask about, air quality. And
great.
That is your name, sir?
Commissioner David Hearn.
David Hearn, thank you. Chair to Mr. Hearn. With the air quality situation, when there, when we have a lot of debris, then sometime on top of the trash and debris, we have houses that get on fire. So you got air quality problem. You got debris, you got trash, you got a house that was on fire. That house sits and sits and sits, and that caused a lot of chemicals and particles in the air that the residents are calling because they're dealing with a lot of health issues. So how often is the air tested in our urban communities that we deal with so much of different type of just stuff? I just say the least, Chair, to.
Stuff is fine, Councilwoman. Okay. We have a network of air monitors that are running at varying schedules, but many of them are continuous. So they run 24 hours a day. And they're located in different areas of the county. And we're happy to share that information with you or with anyone. It's all online, but we can get it to you. We also have, if someone is concerned about their air quality, because we're measuring, if you will, the average air. So in order to check our compliance with federal standards. But for people who are concerned about their air quality in their backyard, and yes, that's important. We do have some samplers that we're happy to check out to people to let them know how to use them, and then test them and let them know what things may be of a concern to them. But if there's a situation like you described, when there is a situation like that, If they can please contact us through 311, through our air complaint hotline, we're happy to come out and see what we can do.
Okay, thank you. Thank you for the answer. That's a good answer. Thank you. Next question. I want to go, next question is to the, I forget your name, I'm sorry. I should know you very well.
Lita Wilson.
Lita, Chair to Lita. Question about your, about the mental health partnership that you are doing in the community. Do you connect with Merlis Taylor that deals with a lot of mental health issues?
Through the chair to Councilwoman Gray, we have partnerships throughout the community with various providers and also sit on several committees with the teams from those providers like Merlis Taylor. We do not have a formal agreement with Merlis Taylor, but I think one thing to be aware of is that we have changed some of our programming in response to the opioid crisis. Instead of doing what we were doing was some sort of gap and minimal actual treatment services that for clients that were referred to us through Cleveland City Drug Court, at which point through the last several years we've been seeing minimal numbers of clients. And so what we're doing now to help address especially the opioid crisis and fallout from that is more community-based outreach education, but also services. So layperson naloxone training is one of those, as well as a project that we have using a curriculum called CRAFT, where we're partnering with our we'll partner with other entities, of course, but we're also partnering with our own rec centers here in the city of Cleveland to provide, it's basically a curriculum that trains friends and family members, and there's a component to it for youth who have someone in their life or in their family that is dealing with addiction. And so it gives the friends and family and children in these situations tools to cope through those those crisis moments, and sort of being able to attack the problem in that way, and making that really more resources available to more people to have an idea of what to do, where to go, how to get help. And also we are providing some screen care act events, meaning, say for instance, when at our city health centers we do a food giveaway, and so when those folks are coming to participate in that, our Office of Mental Health and Addiction Recovery is there with information and outreach materials, also doing screenings around things, around drug and alcohol abuse, around even tobacco cessation, to help your average citizen to take this short little test while they're waiting to see if this is something that they really need to look into and think about getting some help, and then making that connection there. So we've been doing these items in conjunction with, we have a grant in conjunction with Cuyahoga County Board of Health to the Overdose Data Action Grant. And what that means is taking the data from the communities around addiction issues, around overdose, and making sure that we're plugging in additional resources to there, and we're using that to springboard to make sure that we're getting public health messaging around addiction issues and several different types of addiction issues out into the public. We're also present on the mobile unit when Commissioner Mills and the health unit, when their teams go out, we have someone from our team on that van to help assess for addiction issues as well.
Okay, great. No, great knowing that. I want I want to get some information, out to the, resident in Ward 4. Thank you.
Sure.
And also, I have two more questions, Chair. Also to Commissioner Francis, yes. How do we, Chair to Commissioner Francis, how can we schedule the mobile unit?
The mobile unit can be scheduled through our website, and the mobile unit can be scheduled by giving us a call.
Okay.
So,
Okay.
either way.
Okay, and so just tailgating off of Councilman Joe Jones, could you repeat what you said? What does it, consist of, and what does it serve?
Sure, what we offer on the mobile unit is a reproductive health services education. We can do blood pressure screenings on the unit. Also, we have our partnership with the Office of Health Equity and Social Justice. Their staff is on the unit as well doing simple drug screening. And so a lot of it is condom distribution, just being available to answer questions for individuals. That's what we've seen so far this year as we've been out a lot at Zelma George. Just people, adults and children, are looking for condoms a great deal, which is great considering our STI numbers across the city of Cleveland. And so being able to answer those questions, if somebody wants a OBGYN exam, we can do that. We can do urine-based testing as well.
Okay, thank you. Thank you. And my final question is to Director Magolians. I want to say thank you. Thank you for assisting with so many of the families, dealing with the lead-safe abatement testing, with these slum landlords. And I want to say that you are available. I even call a director at 7:30 in the morning, and he picks up his phone. And that's how attentive he is, Councilman Joe Jones. He gives me good answering. He sent his health inspectors out when I do call him for various things, gas stations, vacancy, run down these corner stores that we have in our community that are deplorable when you walk in the door. He's very attentive of sending his health inspectors out. And he gets the job done. I have various gas stations that has been cited and cleaned up and still cleaned up. He comes out and meet me at these gas stations, at these storefronts, and then he make appearance. He go visit the residents on the street when they actually call me, and I call him, and I take him to the homeowner's home. And he leave the cars if they're not available, and then they actually call him and stop calling me, which is sometimes a blessing, as we know. So he's very attentive when it comes to these areas that, that they think they have a right, because they are private property, especially those gas stations and these corner stores that's been vacant for so long, and that's deplorable to a certain degree. They just don't give a hoot, but he has given me so much information, and I am appreciative of cleaning up some of these places in our community, and some of these stores are actually closed down on their own. Per se. So just to give you that much of a holler, I'll just say that in terms that I thank you for that, for helping the residents and myself in Ward 4. So I close share. Thank you.
Thank you.
Thank you. You came in with 50 seconds left, Councilwoman, so very well done. I'd like to hand it to Councilwoman House Jones.
Good morning. Thank you to the chair, to the team here. Just a couple of questions. I'm going to start off with the how, really just if you all can share the update of how operationalizing equity is going in our departments. If you can give a status, what that looks like, where we are and where we're going, that would be appreciated.
Thank you. Through the chairwoman to Councilwoman House Jones. This past, I believe it was very early in September, the mayor had approved several months ago the strategic plan for the interdepartmental equity team, which is a 3-year plan, as well as our health and equity impact assessment tool that we've been using. So that was all approved several months ago. It is now available on the city's website. to read the plan, but to also look at that health and equity impact assessment tool. And so our next phase of that is utilizing the health and equity impact assessment tool. And what it does is it basically allows us to examine a particular policy, practice, procedure, program, piece of a program, to gather data and information on it and to be able to understand a few things. Number one, thinking about those questions that we ask when we're trying to determine whether or not something is equitable, looking at things like who benefits from this project or policy, looking at who is not benefiting or participating, understanding any demographics that we have related to participation and things like that, to see if we have either a negative equity gap. We're seeing more use of something on the west side versus the east side, or we're seeing senior citizens seem like they're not participating in this, and then asking those questions. Why is that? Is it that it's only accessible online? Is it that it is not very accessible to begin with, or the forms are confusing and hard? Looking at all of the things that we put into the services that we provide every day to determine if there's a negative equity gap, to determine if there is a negative health impact. With something, we're currently running those assessments on a voluntary basis. So we have several, the interdepartmental equity team, the structure of it, we have several people from across different departments. And so they've all had things within their department that they're like, ooh, we want to run this health equity tool on this particular project that we've been doing for years to see if there's an equity gap there. So we're using it internally first on several different policies, practices, procedures. It's now available for anyone across city departments to be able to get help putting it, their policy or practice through it, to have some findings at the end. We may see things that are very successful and have no equity gaps, no negative health implications, and we want to be able to document that to say, what is it about this project or program or procedure that makes it work this way, and how do we replicate it? And we may be able to find things where there are gaps, and it gives us a chance to have a conversation and to begin to address that moving forward. We are hopeful that at some point this tool gets wider use, so that not just within internal to City of Cleveland operations, but anyone who is doing business with us or might be having a contract, say, with my division or any other department or division, would also, before that contract is approved, will run this health and equity impact assessment on that particular initiative to be able to look and see where there are problem areas and allow us a chance to address it before something gets out of hand. So we're in the process now of, we have several of those impact assessments in the hopper, and we expect by the end of this calendar year to have 4 to 6 done, and then over a full calendar year moving forward, we'll have upwards of 12, we believe, in 1 year.
So just a follow-up through the chair to the commissioner, as you talk about the goal in 2025 is to have 12, is that 12 policies, 12 departments? Can you explain? I'm trying to get an understanding and clarification.
Thank you. Through the chairwoman to Councilwoman House Jones, we're looking to have a minimum of 12 of those health and equity impact assessments done. There is other work that happens with the interdepartmental equity team in terms, and that's in the strategic plan in terms of the indicators that we monitor around health disparities across the year. So we'll be making sure that we have a report out every year on those indicators, but also making sure that we're doing these impact assessments and monitoring those findings. And then, of course, the separately, the equity advisory group, we have been moving on several diversity, equity, and inclusion recommendations that team came up with, that they're divided in terms of time period. So there are certain recommendations that we hope to address within 3 to 6 months, some that take a year, and some that we think are more long-term that would take more than a year. And those are also available on the city's website.
And I guess through the chair to the commissioner, if you can share if, where has the law department just in this process of having the health and equity assessment tool as we are looking to standardize this practice, because that's the ideal goal. Where has the law department been in implementing or beginning to utilize the assessment tool in the City of Cleveland's laws and policies?
Sure. So far, we have not had a request from the law department to run the equity tool, but we do expect that we may have some interfacing over this next calendar year.
Yes, so I will, through the chair to the commissioner, offer a suggestion, request that in 2025 it is prioritized, that the law department actually, some type of way, and I'll put it on my list of notes, to ensure that they begin to work, because we as a system, fundamentally, it's our policies. And if we are not getting to a place to get in a routine and practices of assessing what we are doing, we are only going to continue to exacerbate many of the disparities and inequities we have through our policies. So as we are, like I said, this is going, I know it's going to take a while, take years, but the Department of Law, I think, is very key in ensuring those things. My other question, going through the chair to the team here, following back up on the violations. So, and this was really sparked, I know Councilman Jones talked about it, but like this past weekend, I started off doing a tree planting with St. Casimir Church, Western Reserve Land Conservancy. Then I stopped over at food distribution. This was this Saturday. Food distribution over at Emmanuel Christian Church. And then I was going to pick up something to eat, but then I went down Superior, and then I look, and I'm like, of course, I see a whole bunch of, it's just like trash, just trash and trash, 7605 Superior. So I went to turn around, then I go down 76 Place, and then I'm like, what is this car doing here? A random car, right? So of course, I send the car description to the police. Of course, it was a stolen car that was hid off in the thing. I have not put in the report for the dumping, but I do have the pictures. I'm saying this all to say this was literally what happened in like a span of 30 minutes, and I'm just like, this is exhausting. Yeah. This is just one little thing where I had the capacity to stop and take the information in and then prepare to follow up today. Getting back to the question of, we have the data or the initial information of 3,862 violations of some reports of, but understanding what does that even mean? And I think this is one of the issues where I'm challenged with in the city of Cleveland. We give a lot of numbers of, we got this many calls, such and such and such, but we never know like the full complexity of what is actually happening, right? And it's like you get a call in, and then what? Someone can visit, you can see it, like the trash in our city is, in some parts of our city, it's just overwhelming. It is overwhelming. And I am really trying to think through how to put forth solutions to address it. It's a lot. Yeah. So if you can explain how, in this instance, I'll just take this one. You put a complaint in, and then what will happen? Like, tell me the operation of how does this work?
Yeah.
Is this even a public health thing, for one, or not?
To the chair, it's an excellent question, yeah. So our current system is making the most out of what it is for now. You all, the council, have invested a lot in the 311 system. And so that is where ultimately the best data is going to be kept. And so once the health department is in 311, you'll get a much better feedback on data and responses, automated. You'll be able to upload pictures. In our current system, the 3,800 complaints, we'll be able to give you that data. I'm sorry it's not coming every month. I thought it was. But it does leave a lot to be desired just because there aren't as many, it's just not as robust as what 311 will offer. But you put in a complaint, we assign an inspector will go out and see if there is a health code violation that they can see visibly from the sidewalk. If there is, they'll either give a ticket or a warning or a violation notice and a court summons. And sometimes that leads the property manager to change the behavior, and other times it takes a few more nudges from either the commissioner, or the inspector, or me, or another department. And so it leaves a lot to be desired, and we're actively working on getting it better.
Okay, so 2 points through the chair to the director. At what point will the public health be incorporated in 311?
Through the chair, Councilwoman Moore, the chair asked that earlier, and I don't have an answer. It's up to ITS to say when they're ready to take us on. I think they've rolled it out through one. It's been very successful with building and housing, public works, but we're on the list. I'm just not sure where on the list we are. Through the chair, we are ready.
Oh, Jesus. Okay, listen. All right, through the chair to the director. So I heard what you said. It's we issue a violation. That violation can be either a warning or a court summons. Similarly, is there anything that is associated with just fining people for what you see?
Through the chair, that's the tickets, the civil tickets.
And the civil tickets, how much is it?
I think it's, through the chair, $100 a day.
I believe it's $100 a day.
Yeah.
$100 a day?
I believe.
How much, and then this is through the chair, it's just a violation, it's not the actual cleanup of what you actually see.
Right, through the chair, that's the challenge we described earlier, is we are enforcement, we're not cleaning it up, but we do have a strong working relationship with the illegal dumping team that has cleaned up. I think they're up to 40 tons of garbage that they've cleaned up this year.
Right. So through the chair to the director. So this is the thing of if we can look at this whole ticketing thing. Again, I would really be interested. Did you all share like how many tickets did you all do, or that was the 3,806? No, that's just. So do we have an idea of how many tickets we issued?
Through the chair, we can send that to you.
Okay.
Through the chair, at this time, we were going to send you all the data in preparation for the budget book, so the end of the year. So we'll send it, but we can send it to you what we have.
Right. So this is part of the thing, and I know we are undertaking through the chair to the team. We are undertaking kind of this new process where we talk about the operations, and then we have a budget conversation. But you have to be prepared. You know, it's hard to have the operational conversation without the context to be able to, you know.
The chair, my apologies. But
No,
yes,
it's
we'll
okay.
send you that and follow up.
And again, it's okay. We're working through it. We're working through it. I'm gonna just do my last little.
Yeah, you got a minute. I'm sorry.
That's right.
Councilwoman.
That's cool. And I just, again, I've been working to propose in 2025. Your team, I've been working with the team of air quality, of working on environmental justice to actually define it. It's 3 years in the making, but it will be done in 2025. And Ms. Yvette Mitchell has been very instrumental in that work. And so I want to lift it up. I know she think I forgot, but it's just, again, the reporting the trash that you see with the stolen car literally has taken up and sucked up all the energy in my life to be able to fundamentally do some of the policies. So just to the air quality team, just please be prepared for that as we go into 2025. Thank you.
Thank you, Councilwoman. Right on the money. And I'll just add a addition to that what we found this summer was that the referrals to Public Works were falling through the cracks. We had 2 situations where something wasn't handled, and when we tried to backtrack what had gone wrong, it had turned out there was a violation from Health, and Health believed that they had sent it to Public Works, but Public Works never received it, and that had let the situation linger for months longer than it had to. And again, it's because there's no affirmative feedback loop to council that every time we ask for an update, we have to affirmatively come to you guys, and that's, I think what the councilwoman is getting at is, and certainly I know what I'm getting at is that the 311 element for us is about a feedback loop, that we are just sending these into the void, and then our constituents are bugging us, we're bugging you, you're bugging your inspectors, and then as this gets onto multiple violations, it's dragging out much longer than it has to. I have Councilman Starr ask for a point.
Yes, my point, I think some of the colleagues covered it, but I just want to make sure clarification through the chair to Director Magolius. I know we speaking offline about gas station owners. And one of the things that I deal with that is challenging is some of them do not keep up the maintenance of their property. So you have a lot of tree branches, trash, all type of stuff around their business, but their business is still operating. How do we do more as far as enforcement on making sure they are cleaning up their property? Because when they have all of this trash, garbage, that's on their property, just pollution into the environment. What is type of enforcement do we do, or what is the process of different levels of enforcement that the Public Health Department is able to do to get them in compliance? The number one thing is, I don't believe we work to try to get rid of people, but we're more so try to get them in compliance to do what's right based on the policies and the laws that we have in place in the city of Cleveland. We're not into the business like, hey, get out of here, move out of here.
Yeah.
No, we want you to have your business here, but we want you to operate in compliance with the laws and policy that we have. So what do we do, or what's the steps that it take in order to help get someone in compliance as far as a business who have a lot of different illegal dumping and different things on their property? Through the chair.
Through the chair, thank you, Councilman. So if there is a local health code violation, or if you think there may be, just let us know either through the website, calling 311, they'll enter it onto our website, or you can reach out to Commissioner Chambers or myself. If there is a food safety concern, so you're in the store and you feel like there's expired food or a dirty kitchen or concern about food poisoning, you can do the same thing. It's just that'll be our state health code food safety program that goes out there and does the inspection with all the equipment that they have to make sure that the right things are happening.
All right, thank you, Commissioner Chambers. Through the chair, I'll be reaching out to you so we can do a ride along. I'd love to take you around so you can see some different things in the ward, give me some of your expertise, how to handle it, and see what we can do on some different properties. Thank you.
Thank you so much, Councilman. So I just want to give us a quick order of operations because we're headed pretty rapidly both towards caucus, and I know a number of us have things to do before caucus. We have Councilman Joe Jones is asked to be put back on the list, and then we have one which should be a pretty easy peasy piece of legislation, and we're going to try to wrap it up after that. So Councilman, I'm putting you back on to ask your questions.
Thank you, Madam Chairwoman. I appreciate it, and I'll try to move quickly. We started with nuisance, right? So for us, the biggest issue, and we love the health department, all that the various different divisions do, but the biggest issue getting back to nuisance. My colleague Richard Starr talked about that. I have a gas station I've been calling the health department on. I've been calling the building and housing department on. We still got issues with it. I can give you that information offline as to not to have anybody be embarrassed. But there's a number of issues that are ongoing in our communities, and it makes our neighborhoods like ghost town. So if Cleveland is to be serious and to really talk about how we deal with resident issues, we must get more nuisance people online. 5 or 6 is not enough. There was a time that the city had 12. And we need to go back to that particular period of time when we had 12 inspectors out here. And this was some time ago, but we had a much more robust proposition. We could move forward and offensively deal with issues. Madam Chairwoman, we have some of our greatest calls, our biggest calls are on, next door neighbors, garbage, pile-ups, wood debris, more trash, empty and abandoned properties. People have left their debris and garbage there. We're calling that, people are calling the health departments. The turnaround time is 60, 90 days. And then they call me, and then I call you. And so the issue is how do we, and that's the ones who get to me, right? So if we could do that, I think, Mr. Chairman, to the director, you want to get to where what the other departments seem to be working normally. When people come in here and they're asking for birth certificates and stuff like that, that's fine. When it comes to air quality, our people don't call really for air quality unless there's some kind of restaurant. But the biggest issue that residents call on is the nuisance issues, next door neighbors' uncleanliness, grass not being cut and kept, vegetation in our main streets and our main strips, and then just obvious stuff where you have containers and garbage containers overflowing on our main streets. Now, we don't have it as bad now. I think that, Madam Chairwoman, the city has done a much better job than what they have. This administration has done a great night and day difference, you know, from what I walked into the door for. But at the end of the day, my humble suggestion is if we have 6 inspectors, can we bring that number up to 10? Can we look at how we redirect things? Because you have your department, Madam Chairwoman, to the director, that's trying to do its best to build up. And then you have building and housing with a new director as well, and they're trying to do their best to build up. But if we could work on that, it would make the voters who are making the phone calls, and see, that's the most critical piece right there. There's a reason why we're struggling in this election. Voters want to know that the governments that they elect into power is taking care of their issues, and this is one of their issues that they constantly call me on, and I just can't say it no more clear than that. Okay. You know, if we can get, even if it's 1 or 2 more inspectors, you know, is better than what we have right now. So delivering services to the voters, they will be very appreciative, and when it comes around to election time, they're going to vote in the direction where they made that phone call to that health department for the first time, and those people are out there taking care of that business. And one of the another issues is abatement too. You know, when it comes to, and I don't know what we're doing in terms of stray issues with raccoons and with groundhogs, but we get a lot of phone calls on that. A lot of times what I'm telling people is to get traps, to purchase traps, and I'm telling them where to go and purchase those traps. It would be even nice if the city was able to buy volume traps and then sell these traps to the residents at a very discounted rate. That would be something that would be good, because a lot of our senior citizens, and I know you get all these calls all the time. Madam Chairwoman, to the director, how many calls you get on these kinds of situations?
To the chair all the time.
All the time.
All the time.
So again, so this is another issue where you take care of the voters. If the voters know that they can call upon their city to get a trap at a reduced cost, then guess what? You know, we know that Home Depot is selling these traps right now for $100. You know, and at one point they were $50. So if we are purchasing and buying these traps, and when those people call in, instead of telling them they have to pay $125 or $225, I had a lady who paid $225 just to get a skunk removed. And she called me up and told me that, and it made me sick, because I could have went and gave her a trap where she wouldn't have had to pay all that kind of money. And she's a senior citizen on fixed income. So this is how our government needs to work for our people. So if we could do that, that would be great. Now, I want to move real expeditiously, Madam Chairwoman, because I know we have a space of time here, and I want to respect you as the chairwoman here and try to do my best to move quickly through these other areas. Division of Environment. In the Division of Environment, how many staffing people do we have currently in there? Are we fully staffed right now?
Through the chair, we have about 4 vacancies right now.
Okay. And the Division of Environment handles air pollution stuff. You gave an example on your slide showing how we looked at one point, I think a year or so ago, when they had the fires up in Canada.
Through the chair, that's the Division of Air Quality.
That's Division of Air Quality. Okay, that's where we're talking about then.
And
so in the Division of Air Quality, when you receive complaints and you investigate those complaints, do you give any penalties as it relates to those type of situations that you know are happening if there is damage being caused to the water or the air? Have we given out any stiff penalties? And do we have the capacity then, the next question is, to give out penalties?
Through the chair to the councilman, we will issue notices of violation, and that can be for impacts to individuals, to the environment. And again, as has been said earlier, our main goal is to try and have the responsible people correct the issue. At times, we do proceed through the Ohio Attorney General's office to seek additional corrective measures, and those can be different covenants that require additional controls or require additional improvements. And sometimes there is a monetary penalty associated with that.
I see. So basically, you can issue the situation and kind of follow up on it, but you don't, do you have the teeth to really fundamentally take them to court, go through that process?
Through the chair
And
to the
I got a
councilman,
reason why I'm asking that.
we do not issue tickets or on-the-spot penalties.
So
But we do try and correct the issue on the spot.
I see. So if we have a situation where we know that there is a person who is violating the rules, right? And say somehow the neighbor caught him, as an example. But your inspectors didn't catch him, but the neighbor caught him, and then the neighbor caught footage. How do you handle a situation like that?
That becomes challenging. I will admit it up front. That becomes challenging. But at that point, we would consult with Ohio EPA and the Attorney General's office to see, does that rise to the level of evidence that they require for us to proceed with the enforcement action.
I see. So I'm going to talk to you offline about this issue. And Mr. Chairman, moving on to the Health and Equity and Social Justice, Mrs. Willis. Ms. Wills, Commissioner Wills. This program, now I presume that this is the various different programs you operate to. Do you operate the actual health buses too?
Through the chairwoman to Councilman Jones, no, I don't. The mobile units, the buses are within the health division.
Okay, so the Outmetrics program, Madam Chairwoman, to Commissioner Wills, for the Moms First program, Commissioners, who handles that? Commissioner Wills,
Moms
right?
First?
Is it Mills or Wills?
Wills.
That's what I was saying. You messing me up over here. You leave me alone. Madam Chairwoman, to Commissioner Wills, so you handle the new participants, mothers, fathers, infants program, and you have this Outmetrics here that comes all the way down and talks about your services for mothers and new births and infant mortality and all that. I guess we, at one point, in the zip code 44128, we received some of the highest infant mortality rates, far worse than third world countries in this nation, in this city, in the 44128. How are we doing in that area right now?
Through the chairwoman to Councilman Jones, yes, this is that program was within my area, and I am aware of the conditions that were in 44128. Previously, that is no longer the case in your ward, thanks to that very targeted work that was happening in activism. However, our infant mortality rates are still too high. What I can tell you is that there are several more initiatives happening across the city, not just what we do with Moms First, but within Moms First, we always understand that within our programming for our participants, the services that we provide, our infant mortality rate tends to be a lot lower than the overall city of Cleveland rate. And just for an example, where the overall IMR infant mortality rate for Cleveland back in 2022 was upwards of 11%. And so within the program, we see a 3%. And this can fluctuate. It can go down, it can go up, depending on a number of things. What it tells us, though, when we see that big of a gap between folks who are in program and folks who are not in program, or just overall in general, is that it is worth what we're doing to expand those services. And whether that service means we're expanding our direct services through Moms First, which we work very hard to make sure that we're pulling back from coming back to normal levels since COVID.
So how do we reach them would be my question, Madam Chairwoman, to Ms. Wills. How do we reach, is there like a certain thing that, you know, where it would trigger us to know when someone's pregnant in the city and you can target them?
So how we reach them for our particular program, this is community health workers that go do home visiting. And so a lot of it is self-referrals or referrals. We have one of our agencies that works within the school district to work with adolescent cases and moms. We have community education or community organizations on each side of town that are doing referrals. We take the referrals in at the health department and at our satellite locations that are working on this. And also the mobile unit is a part of this. We do have, if you'll remember, we used to have the Mom Mobile. Those services that were mostly outreach and education have always been in conjunction with what Commissioner Mills does with the mobile unit and reproductive health services. We still have that relationship. The driver for the current mobile unit is the Mom Mobile driver who's always done our outreach and education and things like that. We make sure that we have billboards, advertisements, radio ads, doing a lot of work in partnership with other programs to make sure that we are also not only referring into our own program, but making this network of infant care and infant maternal health care work better across the community.
And Councilman, I'm going to give you a chance to respond, but no additional questions. Then we got to move on.
Thank you, Madam Chairwoman. To Ms. Wills, I just want to thank you for giving me a little bit more insight on this. And then I just overall appreciate the health department and the work that you do. Our biggest issues would be having more enforcement, code enforcement in our neighborhood. So, you know, look forward to working with you, Director, and being able to hit some target spots that just need, unfortunately, consistently need to be taken care of. In some areas, Madam Chairwoman, to the Director, we just have a problem. So with that being said, thank you overall for the work that you do. Appreciate your quick response and your professionalism. Thank you, Madam Chairwoman.
Thank you very much, Councilman. I'm now going to gavel us into official session of Health and Human Services and the Arts so that we can read Ordinance 1143-2024. Inez, could you please call the roll? Here.
Here.
Thank you very much. We're going to turn now to Ordinance 1143-2024, an emergency ordinance to amend Section 241.05 and 241.35 of the Codified Ordinances of Cleveland, Ohio, 1976, as amended, relating to food shop licenses, fees, and categories. Director.
To the chair, to council, thank you so much. So this is our annual presentation before you where we update our food fees based on the previous calendar year's use of staff. There's a calculation called the cost methodology where we type in all the hours worked divided by all the food service operators, and it comes up with the fee for each of the different classifications. And as you can see, just a slight few dollars here and there variation from the previous year. And Commissioner Chambers is here for any questions.
Thank you very much. So for those looking along on their tablets, for instance, we're going from 1628 to 1740, from 100 to 110, It actually looks like one of them is going down $5 is my read, from 365 to 360. Do I have any questions from the committee? Councilman Harsh.
Madam Chair, through the chair to the director, what's the expected increased revenue from all of these combined? What's the expectation of revenue collection changes? How much more do you think you're going to get by doing this?
Through the chair, as the chair pointed out, some of these fees are actually going down. So it just depends on our staffing year to year. So this is looking at 2023's staffing, where we were, if you all remember, we were down a bunch of inspectors. So 2024, we're better staffed. And so when we come back to you, hopefully in the spring, to adjust our food fees for the following year, there will be some increases based on our staffing this year, which we're better staffed.
I'm sorry, maybe I asked the question wrong. I'm just talking about the fee changes, going up $5 here, $10 there. I know one goes down, but most go up a couple bucks. We're on the ordinance, right?
Yeah, absolutely.
There's like 7 pages of fee
Yeah.
changes. So
Yeah.
my question is, how much more revenue do you think the department collects through these changes?
Through the chair, most of the fees are going down. If you look at like page 4 and 5, most of the fees are decreasing.
Madam Chair, I see them all going up. Am I looking at this exactly backwards?
Through the chair, you might be looking at 2024 to 2023, so we're setting the fees for 2025 right now.
Okay. I'm looking at 23 to 24,
No worries.
and you're going down from 24 to 25.
Yes, and then we'll go up again when we set 2026, so this is a good year.
Okay.
Through the chair, you'll probably get upset with us next year when they go back up, but
Okay.
this year we can
We're
also.
going to yo-yo. Got it. All right. Thank you.
Thank you. Any other questions from the committee? All right, I ask that you sign on before we leave, and with that, I will gavel out this session of the Health, Human Services, and the Arts Committee for the City of Cleveland. Councilwoman.
All right, Finance Committee at 2 o'clock. Thank you, sir. Okay, thank you. Thanks, everybody.